Hi there, I'm Dr. Andria Klioze.
And I'm Dr. Scott Klioze.
And we'd like to welcome you to our new podcast, Shield of Life podcast, where we're going to be helping you understand disease and help you understand the normal way the body lives, and then how disease happens and how we can reverse disease. My background is internal medicine and obesity medicine.
And I'm an interventional radiologist. It's kind of the surgery of radiology.
And together, through our dynamic relationship, we've been able to change and improve a lot of disease states in a lot of people.
And we've been doing this for 30 years. That's how long we've been together. So
At least.
It's been a good ride. And hopefully we can help you guys through your life as well. But today we're going to talk about the vasculature. That's going to be our topic because it's related to both of our practices. Andria does disease prevention, reversal, and make sure that you're living a healthy lifestyle so that you don't develop these bad disease processes later in life and require my services. I have to go in and actually fix your blood vessels, and we don't want you to see me. We want you to see Andria first and never have to come see me, right?
And hopefully, if you understand the process, you won't even need to see me. So that's the foundations of understanding the science of how the body works. And some of the things that we may talk about may be an evolution of how ways that we think disease is happening. So they may change over time. But today we will be talking about the vasculature.
Right. So let's go back and talk about when we were one-celled organisms floating around in the oceans, the ancient oceans. Everything that we needed was around us. The nutrients that we needed, we just absorbed in through the cell membranes. We excreted our waste products right out into the ocean. When we left the oceans, we had to bring some of that with us. And that's what our circulatory system, our vascular system is all about. It basically is our river of life. And it brings nutrients to all the cells of our body, the trillions of cells in our body, and takes those waste products and delivers them to the lungs and to the kidneys and the liver and has them remove them from the body so that we can function. Right? So we're going to look at a little bit of anatomy right here. When we're looking at these vessels, there's two different types. What I'm showing you here are the arteries, and the arteries go from the heart to the periphery. They're usually designated as red vessels because they are carrying oxygenated blood, which looks red, right? So this one's going down to the leg, and you can see that it's actually supplying the entire leg with all the nutrients that it needs to function normally. We also have veins, which are not depicted here, but
veins actually return the blood back to the heart. So the deoxygenated blood, or once the oxygen is taken out of the blood through the muscles and through the different organs, then the blue blood, we call it, or the blood that returns to the heart to become oxygenated again through the lungs, is in the veins.
Right, and it also contains the waste products as we talked about before. So because these vessels provide different services, they function differently, they have different anatomic configurations and structures. So we're going to look at the artery right here, and this is basically a cross-section of a small portion of the artery, and there are three components to this. There is the adventitia, the media, and the intima. And you can see that the adventitia is the outer layer. That's the fibrous, strong fibrous capsule that holds that vessel together. The media is actually a very thick muscular layer. So every artery in our body has this media, this muscle that allows the vessel to open and close on demand. It also propagates the heartbeat. So every time the heart beats, it stretches these vessels, and that muscular layer can contract against that stretching and help propagate the blood, because we have thousands and thousands of miles of capillaries and blood vessels in our body, and the heart can't pump all of that, right?
Yeah, so do the media itself, explain maybe perhaps how the media itself, does it contract on its own, or is it always a reaction of the heart?
It's both. It can respond to the pressure, the distension from the heartbeat itself, but if you're in like a dramatic situation where you're volume depleted, you're bleeding out, the media will collapse and tighten up these vessels, narrow that lumen so that you can maintain blood pressure and perfusion to the critical organs like your heart, your lungs, your liver, your brain. Okay, so, and if you don't have that going on, what happens is you pass out, right? If you don't have enough blood supply to your brain, you pass out, and that's the way the body goes ahead and protects you from, killing your brain, right? So if you look at this inner layer right here, this is the intima. And the intima is basically the inner lining. It's one cell thickness, the protective layer. And it basically blocks the cytokines and all of the immune cells that are in our circulation from interacting with that sensitive media underneath of the intima. And it's imperative that this stays intact.
And so the intima layer is very thin and delicate, kind of like the inside lining of our mouth. Is that right?
That's exactly right. It's very, very thin and can be easily damaged. And if you look at this, what happens over time from an inflammatory process, which we'll go into in a little bit, you can see this inflammation will actually damage that intimal lining. And what you end up with is this little tear or disruption in the intimal lining, which then turns into what we call a fatty streak. And that fatty streak is the earliest signs of atherosclerotic disease. And they did autopsies on these young soldiers from the Vietnam War. This starts happening at the age of 19 with the American diet. So you start seeing these fatty streaks early on in Americans.
So we actually know that patients who come in and they've eaten a high fatty diet, but also a lot of chemicals like in sodas and in foods that they eat that are processed and have a lot of preservatives, that inflammation inside the blood vessel begins to happen very early on as we ingest these things. It actually is a free radical, and we'll get into that at another time, but they actually cause damage to that very delicate lining inside the blood vessel, which begins this process. So you may have heard so many doctors and so many people encourage you to eat a healthier diet of vegetables and drink water as opposed to chemicals, because this inflammation begins as early as
19. I mean, in autopsy
that they're actually
studies.
seeing in autopsies.
Yeah, maybe even earlier than that in some individuals. But, you know, anything can cause inflammation. Lifestyle is one, but we saw a lot of strokes and heart attacks during COVID, maybe from the virus itself, possibly from the spike protein of the vaccine. We don't know for sure, but the theory is that that little spike protein was causing inflammation on the inside of these vessels, accelerating this whole process. So if this goes on and continues to go on, well, eventually you develop this fatty plaque, all right? And that fatty plaque will narrow the vessel. If it gets bad enough, it'll actually clot off, and then you cut the blood supply off to whatever organ that blood vessel is supplying. And here we have a picture of the leg. So this would manifest as leg pain. So the patient says they try to walk to their mailbox, they get about 20 feet and they start getting cramping in their calf. That's called claudication. It's a sign of vascular disease. But this is a systemic process, right? So you can have pain in your leg, but that could mean you also have heart attack, or you can have a stroke. You're at increased risk for all of these things. So if you start having claudication, you got to be screened for the possibility of coronary artery disease or disease within your carotids.
Now,
very important.
We talked about earlier how there's two different systems. There's the arterial system and the venous system. So you can have a clot in your leg, and if you have a clot in your leg, basically what can happen is that you get it's a different type of pain and look. So if you have a clot in an artery in the leg, you actually may have a black spot on your toe. You may have black spots on your fingertips if you're having embolic events coming from your heart to your fingertips through the arteries. Whereas if it goes a clot in your vein, it may be a deep venous thrombosis, and you may start off with having swelling in one leg as opposed to both legs. And that swelling may induce pain, and you may have edema swelling around your ankle, and that can be associated with shortness of breath. So these are the kinds of things.
It can be associated with shortness of breath. If it breaks off and goes flying to the lung, then it's a pulmonary embolus. But you're exactly right. So when you have an arterial occlusion, you're starving the tissues of blood supply, and basically they will start to die. And that's when they turn black and they look cadaveric, look like a mummy or something. But when you have a blockage in the vein, you can still get some blood out. It's just tough, goes through small channels, but you get more swelling. Now, you can actually get venous occlusion that's so bad that it can block the arterial inflow. That's called phlegmatia ceruleus dolens. It's a special, extreme case of DVT. But once you start blocking the inflow from the arterial supply, then you get the arterial manifestations where you start losing the limb.
And is that due to a larger expansion?
Just
so that
tremendous
it's
pressure.
Physiologic compression or
That's exactly
anatomical
right.
actual compression.
You're getting
of that
so much
vessel.
compression of the vessels that you can't get arterial blood supply in. So that's an extreme case of DVT. But for the most part, you're exactly right. It's going to be tissues dying with an arterial occlusion. You're going to get more swelling because of retained fluid from a venous occlusion.
Okay.
All right. So we can go on and talk about some of the ways to prevent that, or I can talk about some treatment.
Yeah, so
What do you
you know
think?
what? I think that it's very important to begin to understand movement is important. As you mentioned earlier, how when we move, there's a lot of benefits of movement, not just exercise to lose weight and maintain fitness, but movement actually stimulates vascular supply. So when you're exercising and you're not sedentary all day long, getting up and taking a break. I used to like to take push-ups when I was a student and I would be sitting at my desk all the time. I'd take periodic breaks to do push-ups. But movement is so important to increase that intimal layer of the vessels to then stimulate blood flow through the smaller vessels, the capillaries, so that we're constantly moving. And that increases vascular flow. As we moved into homes and into cars and we're not spending time on the earth, we're not getting the natural stimulation of the earth to maximize our vascular flow. So as a result of it, we have to physically make ourselves move rather than sitting still all the time.
That's correct. And I can show you, as an interventional radiologist, we can go in and treat some of these disease processes if they advance to a point where they're not getting good blood supply. And we used to do what we call atherectomies, that little plaque that you see inside of the vessel. We can go in there and chew that out and actually open that vessel back up. And if you look at this slide right here, I can show you, this is a picture of a carotid artery, okay? And the carotid is the blood vessel that's going up into the neck. And what I'm showing you is this thrombus again, that same plaque that we saw before where you get like that fatty plaque, you get that thrombus from. And what can happen is a piece of that can break off, and that's this embolus that you see flying. And that embolus will lodge in a small vessel up in the head, and it'll block the blood supply to, a portion of the brain. And what you end up with is what we call a stroke, all right? This is an infarction. Now, there's two components to this stroke. In the very center, you got the core infarct. These brain cells die within minutes. There's nothing you can do about that, okay? But there's the penumbra, and the penumbra is actually the stuff around the outside. And you see these little vessels that I said collateral flow? Collateral flow are the small vessels going around that are keeping these brain cells alive, but they're not functional. So when the patient comes in, they can't talk, they can't move one side of their body, they've got a little core infarct that's never going to return, but this penumbra are stunned brain cells that are still alive, but they're not functional because they don't have enough blood to actually function normally. If we can restore that blood flow, you can salvage this penumbra, okay? And that's the whole purpose of stroke therapy. So what we're trying to do is basically restore blood flow and salvage the starved brain tissue that is not functioning normally, okay? Brain cells are dying during a stroke at the rate of 32,000 cells a second, or 1.9 million cells every minute. So that's why it's so important to get therapy as soon as possible. This is showing clot forming behind that embolus. That embolus is basically going to block behind that. It's going to stop the blood flow, so you're going to get acute clot behind it. We can give medicine to break that up, and that's what we're seeing right here. This is called Activase, and Activase works on this agent called plasminogen, converts it to plasmin, and then plasmin breaks up these fibrin fibers, which are the basic building blocks of a thrombus. And once it breaks up these fibers, then you can free up that fresh clot. You can dissolve it and make it go away, okay? So this is going to get rid of the fresh clot, which is great. You may restore some of the blood flow. The problem is this embolus that you're seeing right here, this may have been sitting in the carotid for months, maybe years, or came up from the heart and went flying up there. TPA is not going to break this up. We have to physically go and remove that from the vessels. And we have the ability to do that right now. That's the amazing thing. And you can see right here, this is going in through the groin, and we got a catheter going all the way up into this patient's brain. And you're going to use this little suction device to actually pull the clot out of someone's brain. It's really cool. I mean, it's revolutionized stroke therapy. And you can see this clot sitting up in one of the blood vessels of the brain. We traverse it with a wire, and I can watch this under fluoroscopy. We go up the lower with a little micro catheter, and over that we go through this little suction device. We pull out all the innards of this, and then you just have the suction device. You put it up against the clot, you turn on this vacuum, and it physically sucks the clot back into this catheter, removes it from the blood vessel, and restores that blood flow. And we can do this within minutes. So once we get the patient into a comprehensive stroke center that has the ability to remove the clot from your brain, we can treat this thing really quickly.
So how do you know if somebody has a comprehensive stroke center near them or not?
You got to figure that stuff out ahead of time, for sure, because they're not all over the place. But the data now suggests that so the different designation is comprehensive means they can extract the clot physically, and actually pull it out. A primary stroke center means they can give that medication and break up the clot.
TPA.
They can give the TPA, but that's all they can do.
But they're not removing that nidus or that
embolus,
block.
right?
Yep.
So, the important thing is to get to the comprehensive stroke center as soon as possible. In some areas, some locales, they actually have what we call mobile stroke centers. They're actually ambulances that are equipped with small CTs, and they can do a CT scan of your head in the ambulance and actually determine whether you're having a bland occlusive thrombus, or what we call a embolic stroke, or a hemorrhagic stroke, because the treatment is different. If you're having a stroke where you're bleeding into the head, you don't want to give medicine to break up clot because it'll make it worse. But if you're having an occlusive thrombus or an embolic stroke, that's when you want to give the TPA. So if you can make that decision in the field while you're on your way to the hospital, you can bypass every primary stroke center on the way, go straight to the comprehensive stroke center.
And if you're at a hospital that doesn't have that type of interventional radiologists that can actually remove clot, or neurosurgeons that can go in there with catheters and remove clots, then you need to make sure that they may start you on the TPA, and then usually what they do is they try to transfer you to a center.
That's exactly right. They'll either fly you to a comprehensive stroke center, put you in an ambulance, and get you to a place that can actually remove that clot.
But that's why we always talk about timing. Timing is everything, and every doctor involved in that dynamic process, they're looking at the clot. So as soon as you feel that you have symptoms, whether it be you're worried about a heart attack because the process is the same, or whether you think you're having a stroke, timing is everything. Every minute is brain cells.
That's exactly right. You don't want to wait to see if it gets better in the morning, right? People say, I couldn't move my arm. I was shaving my arm. But that's a sign of bad things to come. You don't wait. You call the ambulance. You get to the hospital. Or
if you have chest pain, you don't wait. If the chest pain is radiating down the arm, radiating into your back, it's very, very intense. Usually we say, if it's a higher level, 8 out of 10, if you've already had chest pain before and you have nitroglycerin and it's not responding to the nitroglycerin, you've taken aspirin, you need to get on board and get involved with the hospital by calling an ambulance or a healthcare system and getting there right away.
And that's kind of a summary of the vasculature and how we get to this point of disease. And hopefully, like I said, through this podcast, you're going to be able to see how to prevent this from actually happening, because the best cure is prevention.
Right. And so, I would have never thought 20 years ago, 25, 30 years ago, when I was involved in hospital medicine, when we moved to the outpatient center, I would have never, ever believed that I'd see the things that I see now. We get people off insulin who've been on diabetics for 20, 30 years. We get people off blood pressure and gout medications and cholesterol medications. We lose significant amount of weight. But the major way of doing that is really lifestyle. There's a lot of medications nowadays that can help with that process. But with those medications, you still have to change the foundation of what you're doing and how you're eating and living your life. We need to be going to bed on time, not staying up all night long. We need to make sure we're eating fresh vegetables. So vegetables and water are the foundation of healing. Not that you not want to have other things to eat, but those become a predominant part of your life are so important. The other thing is that we want to advertise, because we are going to be starting at Shield of Life a new mini course. It's actually a mini workshop. It's a 3-part workshop, and you can learn more about that, so we can walk you through the beginnings of transforming your life through various lifestyles of nutrition and exercise, understanding the pathophysiology of addiction. These are going to be the beginnings of this workshop so that you can understand better how to begin the transformation of your life in this 2023 year. So I hope you join us.
Awesome. Hope you guys enjoyed today's episode. If you have any questions or concerns, you can email us at theshieldoflifefl@gmail.com.
And do subscribe so you can see us again, and share it with your friends.